Thanks everyone for having us. We're really excited to share more about our story and how we're accelerating precision medicine by partnering directly with patients. My name is Brian Neman. I'm the co-founder and CEO of Sanguine, and what we're doing is we're empowering patients by leveraging their health data to accelerate precision medicine for their condition. But before we get started, I want to tell you a story about the biggest, toughest badass ever, Kaylee Zaytouni. Kaylee Zaytouni was diagnosed with multiple sclerosis at age 12, which at the time, 1998, she was the second youngest patient diagnosed with MS in the state of California. And I met Kaylee freshman year of high school when we were both 15 years old. And Kaylee at the time, we didn't know what MS was. We didn't know, it wasn't cancer, it wasn't anything that we've heard of. So naturally, I was scared. I really liked Kaylee. I was concerned about her health. I was worried. So while I was worrying, Kaylee was working hard, and she was fighting back against her condition. And she was doing amazing things. She was participating in clinical trials. She was donating data for research, her blood samples. She was talking to researchers. She was raising money for research. And before I forget, she founded and led the youngest, the most prominent youth-led patient advocacy group in the nation, Youth Against MS, that grew to over 15,000 members across the US. So pretty amazing. And she did that with no Google, no cell phone, back in 1998, 99, and all from a wheelchair. And we're really inspired. I was really inspired by Kaylee's story. And I thought to myself, when I met Christine, I thought that both Kaylee and Christine, they have one thing in common. One main thing is that they have resilience and they have a lot of energy. And where does that resilience and energy come from? That comes from purpose. And what is the purpose? Their purpose is to collect their healthcare data and accelerate research for their condition for the next generation of patients that are coming after them, to find a cure for their lifetime. So with that purpose, you have that energy, you feel better about yourself, and you can accelerate research for your condition. So what we're doing is we want to take that purpose and give it to all the patients in our community. And how do we build that purpose? How do we give that to them? Well, the best thing we can do is decrease the burden and make it as easy for them as possible to participate in research. So decreasing the burden means they don't have to travel. They don't have to collect their records from their doctor. They don't have to they don't have to draw blood from themselves. They don't have to do things like that. And if we can decrease the burden and increase the number of research advocates, then we can have essentially an army of people that are focused on making trials faster and making trials more successful. So the way we do that today is we focus on 5 core values. That's transparency. Transparency for each patient that donates their blood sample or gives us their medical record, or we retrieve it on their behalf. We will de-identify that information and tell you exactly where it's going, who's using it, and why it's being used. So for different research studies, so you know exactly how you're making an impact. In terms of integrity, our second value, we make sure that the research organizations, the pharmaceutical companies we're working with, are actually value accretive, that it's actually making a difference. The third is convenience. We collect your records for you. We structure the information, and we match you with a trial. You don't have to go to ClinicalTrials.gov and search for a trial that matches your medical background and your medical data. And then concierge service. We have a fleet of phlebotomists and nurses that'll come to your home and draw blood or any other type of research service, so you don't have to leave your home. And the fifth and most important thing is positive impact. Knowing that you're actually making a difference is what's going to get you out of bed in the morning, knowing that you helped someone else. And so far, we've had over 25,000 individuals sign up to give us their medical record and biospecimen data. And I'm sitting right next to someone here who's participated. I'd say next week will be your 5th time.
My 5th one.
Your 5th time. And the average individual has participated at least 3 times. So people really love the process. And I'd love to hand it over to you, Christine, to talk about
My story.
Your story and your clinical trials and how we came to be.
Perfect. So my name is, thank you for the introduction. My name is Christine von Raesfeld. I'm a patient advocate. I have been dealing with chronic illness since about the age of 5, and I've been diagnosed with several severe conditions, including CNS lupus. So CNS lupus affects the brain, and during my last flare, I went through a psychotic break. I started hallucinating. And I basically thought the entire world was against me. I literally wore foil on my head to keep people's thoughts out of my brain. So a little ridiculous. Went through a year of chemotherapy to treat that, and a little while later we discovered that my brain had been poisoned. So I was diagnosed with methotrexate. I was diagnosed with toxic encephalopathy from methotrexate poisoning. And so while these conditions are severe, and they have caused permanent disability for myself, I do realize that it's given me a purpose. So for me, hold on, I'm a little spaced because my brain, the brain functions. But
talk about your research experience.
Your
first trial.
Yeah, so literally, the brain damage and everything makes simple things difficult for me. So day-to-day things that none of you would have problems with sometimes are extremely difficult for me. And most patients have a hard time dealing with their day-to-day lives, as it is anyways. Hold on. Where was I at?
Talking about clinical trials and ClinicalTrials.gov and finding studies.
So, sorry. So a few years ago, because of all the issues that I went through, I realized there may not be much that we can do to help me, but at least I can help all of those that come after me. So while having a chronic illness does have its negative points, it has given me a purpose, and it's basically to make sure that no one else has to go through what so many of us are dealing with now. So my main purpose was getting into clinical trials. It was difficult to do. I was with a hospital that did not provide any resources, and they didn't enter me into any clinical trials, so I thought I'd do the research on my own. I was directed over to ClinicalTrials.gov, and I don't know if any of you have ever tried to enroll in a clinical trial, but it's insane. It's half the time you don't even know if you qualify for them. You have to be in certain stages of the disease in some of them, so it makes it really difficult to try and find trials. A few years ago, I was introduced to Sanguine at an event that I went to, and I heard a little bit about their company and what they were trying to do, so I immediately signed up. I felt like this was going to be an easy option for me to do. And I have participated. I'll be doing my 5th one next week, is my next blood draw. And from the whole process, from the very beginning to the very end, the entire staff at Sanguine is there for you. So instead of me going out and looking for clinical trials and trying to see if I qualify and spending all of my time trying to help other people, I actually have them do all the work for me. So I signed up once, and they contact me every single time there's a trial or a research opportunity that I qualify for. They walk me through it. They get my medical records. They even send out a phlebotomist to my house, so it makes it easy for me. It just empowers patients. And I think that a lot of us patients, we sit at home, and a lot of us that are on disability, you feel like you have no purpose, and you're kind of kept down by the system on disability. And you kind of just feel like you don't have anything. And so getting involved with clinical trials gives me a purpose, and it makes me feel like all of these patients after me, regardless of what it's going to do for me, at least it may help someone else along the lines. So.
Thanks, Christine.
Sorry for the brain spacing. That's all.
No worries.
All part of the disease.
So to date, with help from people like Christine, who are patient advocates, we have received over 25,000 opt-ins for patients that are interested to participate in our research. And for those 25,000 people have accelerated over 400 research studies for over 50 conditions in the past 5 years. So pretty amazing things. And what I want you to take home is that if we focus on our core values, and if we focus on continuing to listen to patients, we can make sure that trials are completed faster, We can also increase the likelihood of success of the trials. And that's going to get the right medicine to the right patient. And yeah, you've heard that a million times at this conference. And yeah, it's a moonshot, and you've heard it before, but Kaylee hasn't, and she doesn't believe that. And I'm proud to say that she's now MS-free. And what we want to share with you is that Sanguine can help arm you with the weapons to fight back against your condition. So come find us for some weapons. Talk to you soon.
Can I say one last thing?
Yeah.
I just want to say, as patients, we all just want a cure. And so Sanguine is one of those companies that's dedicated to helping us find them. So.
Thanks, Christine.